You have worked tirelessly to improve the lives of young people in Australia across mental health, homelessness and cancer. What specific strategies do you think are most effective in ensuring that young people have equitable access to age-appropriate cancer care and support, particularly those who live rurally or remotely? And how can we overcome the geographic and logistical barriers they faced?
Look, I think there's two bits to making sure young people have access to care that's appropriate to their needs. One is having staff that can work with young people, understand how to work with young people, have expertise in working with young people that sits alongside their particular discipline, whether it's medicine, whether it's nursing, whether it's allied health. And so critical to have teams that are specialised in working with young cancer patients in this case. Similarly in mental health, similarly in homelessness, it was critical to have people who could work with this age range, understood what a key developmental stage of life it is and what's needed to help a young person engage, because it's not always easy to get them to engage in support. Then the next part of it, I think, is just in terms of young people rurally and regionally, it is difficult. The treatment is large, rare and rarer cancers. The treatment is likely to be in a large metro hospital. It's critical then to make sure that supports are there for the family if they have to transition between country and city and support them in that process, make sure all their needs are met in the best way possible. Down the track, we would love to think that there are ways of bringing a young person onto a clinical trial, for example, who might be in a regional centre somewhere, in a hospital there, and it's done via video conference and it's managed really well and tightly so they get access to the trial, the best possible treatment, and they don't have to shift. They can go home to where they live straight after the treatment and come back. So a few bits really. One is you've got to have the youth specialist staff. You need to have models that can work across rural and regional, and so I think they're a little further away. It just depends on how much specialisation you need in that regional hospital to deliver that clinical trial, for example, if that's what it is. And then I think we are talking about rare and rarer cancers, and so there's a whole piece of work about genomic profiling that's critical to ensuring they get the best possible treatment.
In your 13 years with CanTeen, what do you think has changed and what's on your mission list for the next decade?
Two things immediately come to mind. One is the Youth Cancer Services Initiative. We worked in 2012 and 2013 with the major treatment centres across the country for adolescent and young adult cancer patients, and we created an initiative that sees us deliver funding into specialist youth cancer service teams that cover the whole country, cover every jurisdiction, and those teams are multidisciplinary teams. They've got medicos, nurses, and allied health, so psychologists and social workers, exercise physiologists, working as part of a multidisciplinary team and delivering youth-specific, youth specialist support that is the best possible cancer treatment as well. And so that was a really big step forward in the treatment of young patients. Then we managed to get some funding from the Medical Research Future Fund for clinical trials. Now that funding's coming to an end, unfortunately. We need more funding for dedicated adolescent and young adult clinical trials because the cancers they have are rarer, and so if we're going to do research in those cancers, we need dedicated funding.
And why do you think events like CanForum are so important?
CanForum, someone just said it to me. Someone from a pharmaceutical company and someone else from somewhere else said, this is the event of the year you have to be at. And it does bring together really excellent people who have deep insight into their work alongside patients who are talking about their first-hand experience. And often it's a difficult experience because they have a rare or rarer cancer. I think an absolute credit to Rare Cancers. They have put rare cancers on the map, and CanForum's been a key way that they've achieved that. So absolutely full credit go to the Rare Cancer team.
And what does a better world for rare look like to you?
Look, a better world for rare really is built on the back of genomic profiling. It's built on the back of national data. It's built on the back of us stopping thinking about health in terms of jurisdictions or states and territories. As Australia, our population is so small, we just need to think nationally with rare and rarer cancers. If we're not thinking nationally, it's bonkers. We're not going to be able to get anything done or progress. So have to think national in terms of data, have to think national in terms of genomic profiling, have to think national in terms of clinical trials.